Hey there, welcome back to my channel. In this video, I want to talk about the runner's knee. Hi, this is Wei, your exercise physiologist. I guess when runners run into problem, they will start looking online and they will start typing, things related to knee problem for runners, and then they will inevitably run into and narrow their search into runner's knee. Now, people say that the more you run, the worse it is for the knee, right? Because the more you run, the more painful it is for the knee. Well, to a certain extent, yes, but not everybody will have knee problem or knee pain if they run more. So if you just compare the mileage, right, or you compare the time that people spend on running, there's also something that they may have missed out, right? Because we can have the people running in the same distance. Some people have knee pain and some people without knee pain, right? And runner's knee, to me, it's like a very big topic, and I want to narrow it down because there's just too many factors that will affect your knee pain, right? So I've spoken about the anatomy of your knee, alright? So go and do a search, or you can search online. Go ahead, look at the anatomy so you know what I'm talking about here, right? So over here, it's your knee from the side view, alright? Doesn't matter whether it's the lateral or the medial view, let's just take it from the side, okay? It will look something like that. And over here, let's just also take it from the front and the back, right? So that you have an idea later on when I speak to you about the muscles involved. Okay, now if we just look at the structure itself, we have your femur bone, right? Your tibia bone and your patella, right? Okay, same thing here, all right? Your femur, your tibia. I took out the patella bone because I don't want to confuse you. So let's just take it as this is the front view of your knee. Yeah? We always take our right knee as a reference over here. So whenever you run, right, every step, every pound, right, there will be force traveling through your knee. Okay, let's just not talk about the biomechanics first. Okay, I will talk about it a little bit. Okay, let's just start off without anything. So when you run, every time there will be force between these two bones over here. Okay, this is gliding through. It doesn't much get heat. Okay, the only thing that this is doing is that it is always going in this direction because of your quads muscle that's pulling over here. Okay, and the insertion, the tendon that's always pulling over here. Okay, so depending on the tightness of the muscle, okay, now I want you to think about so your tendon over here, right, comes over here, and then your quadriceps muscle. Okay, so now I want you to think about this as a bow and an arrow, right? So this is your arrow now, right? This is your bow. Whenever you try to pull it, okay, it has a tension, right? So the more you bend, the higher the tension. Now this is, just take it as in default first, yeah? So you have a higher tension whenever you try to bend your knee more because the patella is always trying to go in this direction, same as the arrow, right? So you always have that force over there. Now, if you start off with a tight muscle, okay, the tension is going to be higher, which means that it will always trying to be pulling it towards that direction because of the tightness of your quadriceps muscle. Okay, so that's one thing. Your muscle tightness, okay, can be a contribution of you feeling pain. All right, and especially when we talk about runner's knee, well, as long as you have pain while you run, I take it as a runner's knee, right? Of course, there are more symptoms out there. Okay, I'm just gonna generalize it. Okay, you can have pain on the outside of your knee. You can have pain on the inside of your knee. You can have pain on top of your patella over here, right? You can have pain under the patella over here. Okay, these are potential places where you feel pain, right? Because of the muscles that's involved. I'm going to slowly introduce it to you. Okay, so this is now the quadriceps muscle. Okay, now if we have if we have a tighter hamstring muscle, okay, you are going to feel the pull, okay, some of you at the back of your thigh bone, some of you on the side of your knees, because when you look at the anatomy again, the hamstrings actually attaches over here, right? And then come to the front of your tibia bone. Okay, so this is your quads, right? Now your hamstring. If your hamstrings are tight, okay, it can also give you the problem here or here. Okay, same thing. When the muscles are tight, there's a tension. Okay, every pound is actually making the muscles work more. Right? So then you also have on the side view. Now imagine this is from the outside, the lateral view. All right, so you're looking from the outside. There is this thing called your iliotibia. All right, your ITB band. All right, that is coming from your hip and all the way down to your tibia bone. Okay, and this is also another reason why you can potentially feel something on the side of your knee. Okay, and then from the inside, all right, so there's your adductor, same reason. Okay, so now this is just talking about muscle, right? So what makes the muscle already tighter in that default state? This is where the biomechanics comes in. Okay, I will try to show you what's happening and why certain muscles are taxed when you are doing your runs. Okay. Alright, so for most people who has got a normal arch, this is what the knee will look like, alright, and what the ankle will look like. Right? For somebody with a high arch, you start to see the knee and the arch going this way, okay, going this way, it shifts. Okay, your knee will start to go more to the lateral side. Okay, now when you have a pronated, okay, that means your arch dropped. Okay, you will start to see your knee going inwards. Okay, I'm not trying to force, but when you have a dropped, okay, when you have a dropped arch, your knee follows. All right, so you may see yourself going into this kind of angle, all right, around the knee, and it is quite similar to valgus knee. Okay, so your ankle, okay, your arch sets already how you are going to run and which muscle it's going to load. Okay, that's one thing. All right, so when you run in different or land in different areas of your heel, it also plays a part, right? And this is what I'm going to talk about next. Okay, so from the front view, right, so every time when you run, if you are more like a heel strike, okay, there, okay, your hamstrings will be taking a lot of load, right? And then you try to claw on the floor and try to push it back. Okay, this is very typically how most people with heel strike will run. Okay, so heel first, right? Hamstrings taking a lot of load and then pull it back, right? So for mid-foot strikers, you have somebody going in something like that, okay, and then to pull. Okay, they usually don't have the heels going forward like that. Okay, they will be usually leaning a little bit forward and then pull it back more. Okay, this way and more, right? And those who have really more a 4-foot runner, almost like a sprinter, okay, very fast foot and drag back. Okay, the heel is almost not touching the floor at all. Okay, and that already gives us a clue what muscles they are going to tax on. So this is the second thing. Your strike will determine which muscles you're going to use, right? So how you strike, where you are, your arch will determine where you're going to load, right? So from the side view, right? So heel strikers, it will look like that and all. this way and off. Okay, mid-foot strike, touching and go, touch and go. Alright, and forefoot runners, sprinters, they'll be here and here. Okay, so all this taxes different muscle, okay, and that is something that you need to watch yourself, right? You can, well, treadmill is not the best place to test, but it's easy for you to record a video, right, in a stationary place, how you run. Okay, so there you have. Searching for a runner's knee in Google, you probably can't find the right answer unless you go really specific. So that just tells you the kind of problem that you may run into. Okay, very similar to golfer's elbow, tennis elbow, kind of like the same. All right, so this is just like a term that people usually use because they run a lot, but they can have different problem depending on how they run and which muscles they're taxing, what kind of condition they may already have when they first started. Okay, so everybody is just different, so don't look at it so general, be more specific. A good way to see how you really run is to record a video of yourself. Well, the easiest thing to do is to run on a treadmill and to do a recording, but that's just to get a general sense of how you run. Okay, because when you run in a treadmill and when you run outside, outdoor, it may be different as well. Okay, so that's something that I need you to be aware of. Okay, so when you run, just have an idea whether you feel normal. Okay, if it feels awkward, then that's probably not the way you usually run. Okay, so that's what I have for runner's knee. Okay, so try to go deeper, try to go as more specific as you can, right? So these are the very common problem that runners run into. Okay, so please take care. All right, if you like my video, please don't forget to give me a like, don't forget to subscribe, and if you have any questions, please leave them at the comment section below. See you. Take care. Bye bye.